Sherry Lukes, RDH, MSFAADH, many letters behind her name, has more than 40 years of experience in dentistry. 28 has been spent in academia. In 2014, she retired as an associate professor from Southern Illinois University Dental Hygiene Program, where she taught oral pathology, community oral health, multicultural dental hygiene, and advanced periodontics clinic. She knows her stuff. Her research concentration was in oral pathology, migrant farm worker oral health, and challenges of other underserved groups, resulting in multiple multiple peer-reviewed publications. A pathology fellow and approved speaker of the American Academy of Dental Hygiene, Sherry enjoys integrating her expertise from years of teaching and research into CE courses to empower hygienists in the delivery of care. And Ms. Lukes is a past president of the Illinois Dental Hygienists Association, in addition to being the mental health instructor in our oral systemic educator program. So welcome, Sherry. Thank you so much for being here.
Well, thank you,
Yeah.
Colette. I really appreciate the opportunity to be here. Shall I go ahead and bring up?
Please share. Yeah, go ahead.
Right. Welcome, everyone. I'm really happy to get to speak with all of you this evening. You are what I consider the cream of the crop, because you are passionate about the oral systemic link, not just looking at teeth and gums, but looking at the whole patient, and that certainly includes mental health. And so, my journey is a little different. So first of all, yeah, thank you, National Network of Healthcare Hygienists, for having me. And so yeah, just a little background. I have spent most of my career teaching, doing research at SIU, go Salukis, and my specialty was actually oral pathology. As far as once I retired and began my third career, which was speaking and consulting, and so I've done that for the last 11 years. But unfortunately, and most of that was spent in oral pathology. And so that's what most of my CE courses are. But unfortunately, I have a story to tell. And like I say in my 3-hour course, it's not pretty, but I'm convinced it's one that really needs to be told. I feel like we need to, educate each other in this area, and help others who may be on the same journey, have previously been on a journey, or will be on a similar journey at some point, which is most likely everyone logged on. But what I say in my 3-hour course is, I don't want this.
Yeah, I got it.
I don't want this course to be a Debbie Downer, because there is hope. There's hope, and there's so much help out there. But so my story starts with, as a little girl, I had a great deal of anxiety off and on through my life. One thing that contributed greatly to that was that I stuttered. And so fortunately, I was able to work through that. I was a pretty and became relatively fluent. And yes, and I became a hygienist. But my anxiety and depression actually followed me off and on into adulthood, at times almost paralyzing. But that's where my passion for this topic comes from personal experience, that of myself and of friends and family members. But this course really is not, I did not develop the course because of me. I actually became interested in mental health several years ago, working with Dr. Robert Lee, and he and I developed a course for dental professionals. But my real passion for this course comes from this beautiful young lady who was my daughter, and she died by suicide in July of 2022. And that's where my real passion for this topic comes from. Um, hopefully someday I'll be able to present without tearing up. But I will go to my grave advocating for mental health and suicide prevention. I wore my suicide prevention walk shirt. So, and so years of anxiety and depression that she experienced, even though she was in therapy, she had a support system and all of that, she did choose to end her life. And, I think my husband and I probably, first of all, we're convinced that she experienced some type of trauma in her childhood. Um, after looking back now and after researching trauma and the effects of trauma, we think that she must have experienced some type of trauma in her childhood that she was never really able to remember. And so, yeah, and so we've spent the last 3 years trying to figure out, 3.5 years trying to figure out the why, something I'll never get over. But I'm dedicating the rest of my life to these efforts. I sincerely believe that whether you're clergy, the checker at Walmart, or the dental hygienist, it's everyone's job to help people. And I know with healthcare hygienists, you get this. You know that there's much more to the body than than and that and so it is our job to help anyone that's struggling with mental health issues, just like we help them with their oral health issues. There were lots of times in private practice where I felt like a psychologist as I listened to clients, even with my hands in their mouths. There were many times I counseled with students in my 25 years as a dental hygiene educator. People need and want to be heard, right? And we don't have to be licensed mental health professionals to help people. And so, but I think it's important that before we even think about how we help patients or our colleagues, as with many conditions, we have to remember the multifactorial nature of mental health conditions and the various vulnerabilities people may have for that condition. It may be a combination of these things. Keeping in mind, it can be very helpful for us as practitioners if we keep all this in the back of our minds and realize that everyone's different. Everyone's case is unique. And while some of us may struggle with a certain period of life, it may be circumstantial, it may pass. Others of us may have a chronic illness. Mine is I've suffered with anxiety and depression pretty much my whole life. And so it runs in my family. And so there's a lot of genetics, involved, but all of these things make a huge difference in everyone's journey. But as far as mental health in America, I mean, it is rampant. 1 in 5 U.S. adults experience a mental health condition each year. And unfortunately, more than half don't get the support and treatment they need. So you can see by this data this is data from the National Institutes of Health. Look at among youth, 1 in 5 youth have had at least one major depressive episode in the past year. And over half don't receive treatment. And most of them said it didn't even help. Or many of them said it didn't help. We've had more suicides in the last few years than we have. So, and we have such access issues finding mental health practitioners. We don't have enough of them. And finding the right type of care, finding the right type of therapist if you're going to seek cognitive behavioral therapy. So we don't have enough. And so, consequently, some people do, unfortunately, choose to end their lives. And so we have 48,000 deaths every year due to suicide. And we know the most common conditions people suffer with are anxiety and or depression. The two go hand in hand. And even if a patient has bipolar disorder, PTSD, OCD, or some other mental health condition, they oftentimes experience anxiety and or depression with their mental disorder. And as with all of our patient care, we know that it begins with the assessment phase of treatment. From the moment we bring the patient into the treatment room, looking very closely at the medical history. As we put those various pieces of the diagnostic puzzle together, I know I'm preaching to the choir here because you all are all about putting all the different pieces of the diagnostic puzzle together. And we know our patients well, so even if it's one of the first times we've seen them, there are several things we can observe, even if they don't list a mental health condition on their medical history. Maybe they do list, however, the medications they are taking that we can recognize as being, psychiatric meds. And then when going over the medical history, when you ask about the meds, then they may be willing to talk to you more about the condition that they're being treated for. You can certainly observe non-verbal cues right off the bat. Many times people aren't willing to disclose their struggle with mental health issues. So, but before that encounter, making sure that you include questions on your medical history about mental health issues, and then do a quick screening, such as a PHQ-2, or better yet, a PHQ-4. And so, this is data that, I think is really concerning, that most dentists don't ask any mental health questions. Now, I get it. When I do this course, I tell hygienists, I don't expect you to be psychologists, but your patients love you. And there's nothing wrong with, as we're doing assessment, to ask about some of these other issues as well, and maybe refer. We can do a PHQ-2. My primary care physician does this every time I go in. Now, the PHQ-2 has pretty low specificity, but that's offset by follow-up questions, and it's recommended that the questions be asked orally instead of having a patient answer on paper, so that follow-up questions can be asked, and you can look for other nonverbal cues. So the patient health questionnaire, just 2 questions, in the past couple of weeks, have you been bothered by any of the following problems? And oftentimes they just have a dichotomous yes, no. They don't even have them rate them. Now, you could also, so if you get results on the PHQ-2, then you could follow up with a PHQ-4, or you may want to start out with a PHQ-4. And so, and it's only 4 questions. And then to score it, normal is 2 on up to severe. So a score greater than 3 shows primarily anxiety. Excuse me. High scores on the first 2 questions are more indicators of anxiety, whereas high scores on the last couple of questions indicates depression. And so then follow-up questions can prompt a referral, perhaps to a mental health practitioner, or prompt an extended listening time during the assessment for the patient to be able to vent maybe or to talk things through a bit. Now, we know that assessment of a patient's psychological well-being is actually critical to understanding their current oral disease state and their potential response to therapy. I didn't realize how much mental health and oral health were connected until I started doing all the research on it. But, periodontal disease is increased in these patients. And it's not just, it is both biological and behavioral. It is biological in that um, the um, the association between the mental health condition and the inhibition of immune function. The immune response is suppressed from that chronic psychological stress on the body. And so, along with that, the lack of motivation for home care. The patient can't even get out of bed because they're so depressed. Taking care of their oral health is probably one of their least important things for them to get done. We know that people tend to have more caries. Those with mental illness tend to have more caries. They tend to consume more sugary beverages. Of course, the poor general nutrition overall, and then lack of home care. All of that, we tend to see, xerostomia more, either from the condition itself or from the meds used to treat it. Of course, bulimia, that's a mental health condition, which we can see a lot of, erosion with. Bruxism, we see more bruxism with people with mental health conditions, both from the medications or from the condition itself. So it really is a vicious cycle in that um, all of these things play a huge role. Now, we can notice symptoms in our patients. We know our patients, especially these people that we see every 6 months. And so we may start to notice a change. And so this was from, I think, I usually list where I get my information for sure. I think these were symptoms that were outlined in an article in Dimensions of Dental Hygiene. So, it can start out with just a disheveled appearance. And then, of course, their oral hygiene status may decline. We may start to see weight gain or loss, all of those kinds of fatigue is a huge thing, especially with depression. And again, intraoral signs, dry mouth, signs of bruxism, behavioral signs such as, difficulty concentrating or indecisiveness, especially if these are patients that you've seen and they were always able to make decisions about their treatment, but maybe, at this appointment, they seem very, indecisive. They may talk about not being able to sleep, sleeping too much, and certainly then they may seem like their personality has changed. They may even give signs of suicidal ideation. So these are all things that we can look for in the dental office. And I don't know if you realize that we also see higher rates of many systemic diseases in people with um, mental illness. And so again, it's a vicious cycle because people with a chronic illness tend to begin suffering with depression as well. So chronic illness drives depression. Depression drives some of those illnesses as well. So what are some things that we can do as hygienists? What can we do to help people? And sometimes we may even just recommend, sometimes people think, am I just in a funk? What's wrong with me? And so we can recommend that they access tests. There are tests online that you can take. This is Psychology Today. They have several tests on their website, anxiety tests. We all have anxious times, right? But when do you determine that it's actually an anxiety disorder that needs further follow-up? Or am I just in a funk? Or do I truly have depression? And so they have tests that you can take. So we could recommend that kind of stuff. We could refer, perhaps have a list of mental health providers in your area that you could give to the patient with maybe phone numbers and websites. And depending on how severe you think the patient's mental state is, maybe even ask if they would like for you to call for them. Now, I get it. Again, do we really have time in the appointment to do that? But sometimes we wait a long time for the doctor to come check at the end of our portion of treatment. We could perhaps do it during that time. That time could also be used to do a little counseling with the patient or let them vent. I also think it's important that we have a general knowledge about the meds that are prescribed. In our healthcare system, we have a very pharmacologically based healthcare system. So you go to your healthcare provider about your mental health issue, they will more than likely prescribe a medication. There are so many of them, and they are very safe now. I can't diss medications because, from my own personal experience, once I finally got on the right medication, it works beautifully for me and alleviates my symptoms. So, but it's important that people are able to find the right medication. And a lot of times it's trial and error with your primary care provider. And unfortunately, a large proportion of people don't get good relief from their symptoms with medication. So getting the right medication, and they tend to add. Okay, all right. Um, the research says that over 40% of depressed patients fail to improve with conventional treatment, which involves using a single antidepressant. So they oftentimes will add a second one. So, and I think people give up on medication too quickly. Oftentimes they get frustrated, they're not feeling better yet, or they don't like the side effects, and they tend to give up on the medication, I think, too quickly. And so if you hang in there, and if your provider is good about trying different meds, but you can't just go on and off of them, so it takes time. Now, psychotherapy, you could recommend that the patient gets some psychotherapy. Very, very beneficial. The research shows that the combination of some type of psychotherapy and pharmacologics works best. Maybe one or the other will be, enough. Everybody is different. Everybody has different circumstances. If you're just in a circumstantial type of depression, perhaps just some psychotherapy will get you through that period. But the research does say that both combined works best. It's well documented in the research how much exercise helps. If you're the encourager, I would encourage you to do what the patient likes to do, or recommend what the person likes to do. If the person hates running, nothing's worse than someone saying, "Oh, come on, let's go take a run," when the person hates running. So I would encourage to encourage the person to do what they like to do. Now, some may find relief through prayer or other spiritual activities. Again, everyone is different. For me, that is a huge part of my working with my mental health condition, my spiritual background. I am a Christian, and I, as was my daughter, and I depend greatly upon my spiritual relationship with the Lord. And so whatever your spiritual connection is, it can be very helpful. Going right along with that is meditation and mindfulness. There can be lots of ways to meditate. those in the faith community sometimes poo-poo meditation, but there are lots of ways to meditate. And so meditation, mindfulness, focusing on the present moment, understanding one's thoughts and feelings. We can encourage our patients to maybe look into something like that. There are lots of meditation apps now, and there are even faith-based apps. We have so much at our fingertips now with the World Wide Web. Yoga, especially for our colleagues who have ergonomic pain, yoga can be very helpful. And it is documented in the research, the benefits of yoga and meditation for depression and anxiety disorders. I can't stress enough how important diet is. It's huge. There's a tremendous amount of research coming out about diet, metabolism and brain health. And, hygienists are trained to discuss nutrition with patients, and it can certainly be more than just in the respect of preventing dental caries. We can discuss a lot with our patients concerning diet. This is a great book, Change Your Diet, Change Your Mind. And it's written by a Harvard-trained psychiatrist who's been in practice for 30 years. She knows a little something by now. And she talks a lot about, uh, a lot of what we have learned in the past about diet is actually not accurate. And so she talks a lot about what types of foods are good for the brain. So more of a ketogenic diet, and of course, reducing processed foods, sugar, eating more whole foods of all kinds. And individuals who consume more pro-inflammatory foods and less anti-inflammatory foods are more predisposed to psychiatric disorders. So really important that we look at diet. There's a good website, I think it's called Metabolic Mind, that is really good, and it's a nonprofit, I think, that talks a lot about metabolism and how it is, it is all connected with brain health. So this was what I had put in from Dimensions of Dental Hygiene. This is a little guide for treating patients with major depressive disorder that I thought was pretty good. I do think that we should know the basic symptoms of major depressive disorder and the common meds that are used to treat it, obtain that medical history. There's the referral with other healthcare professionals, and that empathetic, respectful, non-judgmental attitude with the patient, I think, is so very, very important. People are not going to share with you if they feel like you're looking down upon them or standing in judgment. And so, be careful as we make our recommendations and set goals for the patients so that they're not overwhelmed. And beating our patient's head against the wall about string floss. If a patient can't get out of bed, don't lecture them about. I would encourage all of us to be very careful about lecturing people who are struggling with mental health conditions about their home care. Help them, of course, but and encourage them, but maybe recommend some soft picks or something that's better than nothing for interdental cleaning. And in my 3-hour course, I talk more about different aids, different hygiene aids that we might recommend instead of our basic brush floss regimen that we're so ingrained in. I do think it's important that we know the basic drug interactions and dental considerations with some of these antidepressants from the SSRIs. to the tricyclics, to the MAOIs, and how they may affect what we do in dentistry. And then recommending resources for patients to access online for information, or for us as professionals to access to learn more about mental health conditions. So many things out there, from government websites with NIH and SAMHSA, but WebMD is a great, they have some great mental health information. There's NAMI, all kinds of things out there. What are some training options? I think we can take additional CE courses on mental health. There are more and more CE courses on mental health all the time. ADHA has some on their website. And I am working with them right now on having a wellness section that is going to be coming to fruition. And they will have a wellness section on the website specifically for hygienists, for your mental health. But there are some courses on the ADHA website. There's the mental health and dental hygienist certification program that they have. I think it's a 10-hour perhaps. And so you might think about that, but there's all kinds of things out there. Concord dental seminars. I have my mental health course that I think they're going to actually put on their website, that people can take it at any point. Dentalcare.com has one on mental health. There's one that was, let's see, mental health in the dental practice setting. I think that was offered by Colgate. So there are lots of them out there. This is Dr. Josh Austin. I've heard him speak a couple of times. He speaks on mental health. He has had mental health struggles himself. He actually gets out the note that he had written before he had planned to end his life. As far as suicide prevention, QPR, question, persuade, refer. Just so people are trained in CPR and the Heimlich maneuver, we can take training to learn how to recognize the warning signs of a suicide crisis, and how to question, persuade, and refer someone to help. And I've taken this. They have like a 1-hour gatekeeper course for healthcare professionals. Actually, I thought it was very good. It was only like $30. So that's the QPR online gatekeeper training. And we can play a role in suicide prevention. If we think we're seeing signs of suicide in a patient, we can certainly ask them, just like we ask questions on the patient health PHQ. We can ask these types of questions as well. There's nothing wrong with being concerned about your patients and asking these questions too. Now, for other resources on suicide, the American Foundation for Suicide Prevention is a national agency. There's also the International Association for Suicide Prevention, and the National Suicide Prevention Lifeline. Now, AFSP has their 988 Suicide and Crisis Lifeline, and you can call, you can text, you can chat. It's a 24/7 lifeline that you can recommend for clients. Really important resource. Now, these are some action steps that I thought were good from the NIH website. Whether this is a patient or a colleague or someone within your realm of influence, ask them, are you thinking about killing yourself? And try to keep them safe. Keep them away from lethal items. My husband's a hunter. There was a time that he removed all of the guns from our household. So listen carefully, acknowledge their feelings, and help them connect. Either connect to some other type of care, or perhaps the lifeline, and then follow up with them. Stay in close touch after a crisis. For suicide prevention, there are also self-guided digital, interventions for that as well. And you know, the the thing is, with some of these digital interventions, we have to remember that because of the stigma around mental health, a lot of times a person may not be willing to seek professional help, go to see a professional, but they may be willing to use a digital application. And so there are digital applications for that. You can see on the slide from the research that have been shown to be effective in reducing suicidal ideation. So yeah, so all of these things can be considered part of our call to action, right? Um, Ways that we can help our patients or help each other, colleagues. Um, but I'd like for all of us to think about this. We can all be encouragers, whether it's for patients or colleagues. Being an encourager can have significant implications for people who are struggling. This is actually a friend of mine, Sarah Theo. She's a co-owner of CE Zoom, which is a continuing education platform. She has a very compelling story. She actually averted a suicide in one of her patients. A man who came in and she just was concerned. And some of the things he said, she felt like he was in a suicidal crisis. She had had a patient who had ended their life by suicide before that, and she said, and I felt like we didn't do enough. And she said, so in this case, I I called his wife. And a couple weeks later, he came into the office. He came straight to her, hugged her, and said, you saved my life. The dental hygienists, we can make a difference. We can all make a difference. So, I'd like to suggest that perhaps sometimes we need to put down our scalers and just listen. Oftentimes being that listening ear can be so very helpful for patients as well as for colleagues. We're so darn worried about getting every little piece of calculus off the distal 22, aren't we? And I know that's important, but I think that we can go a step farther for our patients if we recognize that they're in crisis. What about the patient who comes into your operatory after a recent oral cancer diagnosis and how that can affect their mental health? They may just need to talk about it. I will never forget visiting my dermatologist right after my daughter passed away. He sees 70 patients a day. He came in and he started looking at my skin like he normally did, and making the typical small talk, asked how I was doing. And I said, well, not very well. We just lost our daughter. He stopped what he was doing. He sat down, he put his hand on my arm, and he talked to me. That meant more to me at that point than anything else he could have done. So I'd like to encourage all of us to be empathetic listeners with our patients. I did this course in Montreal over the summer, and when I walked out of the hotel one day, walking down to the conference center, this sculpture was outside. I was in Montreal to do this course, and I'm like, wow, does that go with my course or what? You know, Empathetically listening to our patients, talking with them can truly lift them up and perhaps carry them to a better place, maybe even save their life. I wish someone like Sarah Thiel had intervened in that way for my precious daughter. That could have perhaps kept her from ending her life. So let me encourage you. Thank you for the work that you are all doing. I know you're doing great work. And here's my information. If you want to reach out, I would love to hear from you more. Colette?
Wonderful. Thank you so much. Your daughter, she's just gorgeous.
Well, thank you.
Yeah.
Thank you.
I
We,
did want to, oh, was there
I was
additional?
just going to say we have a few questions in the chat.
Yeah,
If you're open to answering some questions, Sherry.
sure, absolutely.
Alrighty. Do you have any samples of a mental health referral that we can use in the dental office?
Wow, that is
Or
a
an,
great question.
mhm.
Um, I don't.
Okay.
That's a great question. I I recommend that we refer patients, but I don't actually have a referral form, like a form. Uh,
Hmm.
I usually, recommend that perhaps we have a list of local providers that we
Okay.
could refer patients to, but I don't actually have a form, no. But I think that's a
All
great idea.
right. All right, perfect. Besides coming right out to say specifically, what kind of verbiage do we need to watch for that person that may be having a suicidal ideation?
Yeah. So in my training on suicide prevention, there are specific ways to talk to patients, and they try to encourage you though to be direct, to not beat around the bush, not say, now you're not thinking of doing anything stupid, are you? Or you're not thinking of killing yourself, are you? No, they say actually that you should come right out and say, are you thinking of hurting yourself? Or um, are are you thinking of ending your life? And ask it directly. Um, which when I first started my training, I thought, wow, that's pretty, that's pretty abrupt. But when a person is in a crisis, I think the abrupt approach, I guess they have determined
Mhm.
is the best approach to perhaps bring them out of that so that they will seek help.
Hmm.
Okay, great. Is there any like flag words that we should be like perk up to that they may be saying that would cause us to, further ask those questions?
That the person may say to us.
Yes.
Yeah. So not necessarily any certain words other
Hmm.
than that, that hopelessness, that sense of
Okay.
hopelessness is um is very significant to, to look for. Where the person feels like they can't see past today.
Hmm.
Um, and like with Sarah with her patient, um, he was saying things like, "I just don't want to be here anymore," and
Hmm.
things like that. I don't have anything to look forward to. Those types of things. Now, sometimes we don't we we don't see those signs, or we miss them.
Hmm. Hmm.
I missed them. I knew my daughter was struggling more than normal during this time. I had told her, babe, you really need to go back to the doctor because your medicine's not working. And but I certainly didn't see some of the other signs.
Okay. We had a resource shared in the chat. The Canadian Suicide Crisis Helpline number is 9888.
Is it the same? It's also 988.
Mm-hmm.
Okay, awesome.
Yeah.
Now I will say this about the Canadian Dental Hygienists Association.
Mm-hmm.
I didn't realize that we were going to have Canadians with us. Yeah, I'm so sorry. And I had such a good conversation with Colette, at the beginning. But when I was getting ready to go to Montreal this summer, I thought there may be some hygienists in the room when I was going up there to speak. And I looked at the Canadian Dental Hygienists Association's website. They have a great section on mental health. I was disappointed in
Mhm.
ours, the ADHA website, and so, but I was very impressed with what the CDHA had
Thank
on
you.
there.
Great.
I'll let some of my colleagues know
Yeah.
that you were impressed.
Yeah. And so so I reached out to my colleagues at ADHA and I said, we don't have any kind of wellness section. The the ADA has a great wellness section on there.
Mhm.
And we know that all healthcare providers have higher rates of suicide, you know?
Sure.
Um, and so, yeah, and so I'm actually working with ADHA. They are building the wellness page for the website,
Good.
and it is not finished yet, but she's hoping to have it up by Mental Health Awareness Month, which is May.
Great. Jen, do you have a question?
Yes. So, thank you, Sherry, for sharing your story and for bringing awareness to this. It's a topic that needs to be discussed and talked about. There's so much stigma with mental health, and so getting over that and doing education things like this is a definite step in the right direction. Um, and I am a Canadian hygienist. And I just wanted to mention providing trauma and violence informed care there are some training opportunities with that. I know with our College of Dental Hygienists of Ontario, they had and it's not very, I guess it's just like a good step, providing a safe space for people when we're doing our treatment and informed care, but in and just very, like you said, non-judgmental. But that trauma-informed care, there also is a really good resource. And actually, Colette, it's Alberta Health Services has a really great trauma training initiative going on that's free right now. And so, yeah. And I'm immersed in mental health. I work as a dental hygienist in the mental health unit at our local hospital here. So that's been, I found, very helpful too with doing this trauma training, and it just, and like you said, we don't have to be counselors or like social workers, and we're not supposed to be, but just providing support, and oral
Yeah.
health support too. So, but
Yeah.
I just wanted to mention that about the trauma-informed care that
Yeah.
so some associations might have that available to them, which can be very helpful.
Yes. Yeah. I want to take one of those courses because I've seen those advertised, trauma informed care. Um, so I wonder where else I might be able to get a course on that, on trauma informed care.
Would the Alberta Health be available to anyone who?
Yeah, I think it is. Like, I think you just have to, I think, I know I'm doing it for free. So I'm sure it's Alberta Health Services, and it's a trauma training initiative.
Okay.
Yeah.
Cool.
And there's, I think, like 7 modules. Like when I did it, I did initially with my CDHO, and they actually, which really surprised me with my college in Ontario, but they did provide the link for this Alberta Health Services, and I was like, wow, what is this? And then I got looking at it, and I'm like, oh my gosh, this is a fabulous resource for people to take, and free. So yeah, the
Yeah.
modules are like, I think there's like 7 modules or something. So
Wow. And they're even free.
yeah, nice.
Yeah, that's incredible.
So I just wanted to share that
Thank
Thank
you,
you.
Jen,
everyone.
so much. I'll add that into our NNHH Kajabi community as well, the link there. But Sherry, it's albertahealthservices.ca, and then if you just search
Okay.
that trauma.
Let's see.
All
Okay.
righty.
Thanks
You
so
ready for
much.
another quick question?
Yes.
Okay. Has there ever been any indication of a specific oral bacteria that plays into the development of mental illness, such as depression and anxiety?
Wow. Not that I know of,
Hmm.
not that I have seen in my research. The research
Okay.
has just said that, the dental diseases increase, and it's a combination of
Hmm.
behavioral as well as this suppressed immune response. But that would be a really interesting thing to research, wouldn't it?
Yeah, absolutely.
Yeah.
Um, do you mind sharing the QPR training slide info?
Oh, sure. Let
Thank
me
you.
look again. Yeah. Um, I just and actually I had not heard of QPR
Hmm.
until I did part of a course for ADHA in the fall with a Mr. Harry Bruel out of California. He lost his daughter to suicide, and as a result formed a nonprofit, and he does a lot of, and he's the one that had mentioned QPR training. And
Okay.
I looked it up, and because I was not familiar. Here's QPR. Question, persuade, refer. And so
Hmm.
it's down there at the bottom of the slide, if everybody can see that.
Hmm.
QPRinstitute.com. Yeah,
Perfect.
QPRinstitute.com. Yeah.
Thank you.
Um, in my course, I go into a lot of, anxiety, depression, what are they, yada yada. There's an excellent video on depression that talks about 10 things depressed people do. And I mean, it is spot on. It was my daughter to a T. And it did not even come from an evidence-based website, but it's so spot on. And I was able to download it. And I've had a lot of people ask me for it after the course. Can you, I mean, I always put it in the handout, but
Mhm.
um, but it's an excellent video just on that, because there's so many things that depressed people do that look like laziness or that kind of thing, which it's all part of the illness.
Mhm.
Aches and pains that are all part of the illness. The fatigue is all part of the illness. Just it's I mean, it's spot on.
Do you have the resource where we can grab that or watch the
You know,
video?
I I can look that up for you
Got to be
because
on YouTube, right? YouTube.
actually I'm sure it probably is on YouTube.
Everything's. And is
Yes.
there like the name of it that you know?
No, I no, I no, I
It's okay.
remember I put it in a
Is it in
long.
your module, Sherry, on in the oral systemic educator? I feel like I watched something recently. There
Hmm.
was like fatigue was on there, procrastination, there was a
I
bunch.
don't know if I don't remember the module I did, if I put that video in or not. I usually include it in every course, even if it. Okay, this is the video right here. Can you see this? Uh, you probably can't, can you? You're not looking
Mm-mm.
at my screen right now, are you? Yeah, I found it in one of my others, but I don't have it.
Oh,
I
cool.
have it in the handout. I can send that to you, Colette.
Yeah, sure. That would be
Okay,
great.
perfect.
You
Yeah,
don't mind.
for people to find it online. Yeah, yeah,
All
it's
right,
great.
thank you. And then Jen, did you have another question
Yeah, I
or
don't know.
comment?
I just was wondering, the question, the QPR, is that like a similar thing to like a mental health first aid course, or because I
No,
have,
it's only a 1 hour, and it's specifically about suicidal ideation.
gotcha.
Yeah.
Okay.
Now I've taken the mental health first aid course as well.
Yeah,
Now
yeah,
the one I took was like an all day, was an 8 hour.
yeah, yeah. It's intense, which is really it's very helpful also.
It
But
is very
yeah,
helpful.
yeah.
Yeah, and then also I've taken all the courses offered by American Foundation for Suicide Prevention. And those are really more for like lay people who are going to speak to groups. But I learned a lot in those as well, you know. The interesting thing about mental health and dentistry is that there's not a whole lot in the research about mental health specifically in dentistry or in dental patients. Of course, there's a plethora of research on mental health in general, which can apply to, you know, those of us in dentistry, but not a whole lot about dentistry specifically. So, which I think is interesting. Um,
Um, one of the members shared a resource. The ADHA has a trauma-informed care in dental care right now, and she shared the link for that.
awesome. Thank you so
Hmm.
much. Maybe that's
Yeah.
where I saw it because last week I was getting ready to do this course, a 1 hour for water pick. Um, and I wanted to include about the ADHA resources. And I was on their website and I could not find what I was looking for. But I remembered seeing maybe that's where I saw something about trauma informed care
Hmm.
and thought, oh, you know, I need to take that, you know, because my research on
Yeah.
trauma is, you know, it's so interesting when you look at the research on trauma and how especially in children, and how it affects the developing brain.
Hmm.
Um,
Yeah.
so interesting.
Another one of our attendees shared a story that she volunteers with a place called Josie's Grace, a place for moms in their fourth trimester, experiencing anxiety, postpartum issues, or needing support. We took the QPR training as a group, and she said we cuddle the babies while moms is in the group session.
Oh, I love that.
Yeah.
I love that.
Josephine.
You know, and that kind of goes along with, yeah. Um, so we cuddle the babies while mom is in a group session. Oh, I see. I see. Okay. Interesting. I like that. Oh, so Nanette put on there about the trauma-informed care on the ADHA website. Yeah, I just brought up the meeting, the chat box. Thank you so much for that.
Perfect. Good. Can you guys see the last slide there, the CE Zoom on February 6th? Can you all see that? Or can you just see Sherry's
No, I
slide?
just see this. All I see is the slide.
Okay, Sherry's slide or the NNHH one?
Sherry slide.
Okay, so then I'm going to share this last slide here.
All right.
Share that share. Is it sharing?
I see your beautiful face. That's it.
So is that
I
Carla
see it.
talking?
Yeah.
Yes.
Okay.
Hi, Sherry.
Because Carla responded to an email. I responded to you and Colette the other day, and
Hmm.
I got yours back. Yours bounced
Yeah,
back.
I'm past president, so I'm no longer on the board. So my email has been,
Oh, okay.
yeah,
Oh,
but feel free. My personal email is HYG, the number four, the word life at Gmail.
Age for
Okay.
life. Wonderful.
35 years and going strong.
Okay. Good for you.
Thank you.
Okay, can you guys see my slide there or not? Yes,
Yes.
okay.
Okay.
So Sherry's got a couple of things coming up and she wanted me to let you guys know there's a CE Zoom on February 6th. Now, is that through the one hygienist there, the CE Zoom? Is that the um the organization that you're doing this talk, this going viral? CE Zoom?
Yes, CE Zoom
Okay.
is a continuing education platform. I'm doing a course, an oral path course for them on February 6th, if anybody's, interested. Uh, but but I really wanted to put down where I am doing my mental health course, my 3-hour course, depending on where people are around the country, if they would want to come to these meetings. And I am doing it for CE Zoom again, another webinar for them, a 2-hour webinar for them on October 23rd. I'm doing my mental health course for CE Zoom. So
So the May, August, and September, those are in person, right? Nashville,
yes, yes, yeah.
that Alabama and Michigan.
Mm-hmm.
Those,
Yeah,
okay. And then another online CE Zoom for the 2-hour. Okay.
yeah,
Cool.
yeah.
If you guys want to follow Sherry, she's got her website there as well. You can pop on there and see what are your speaking events usually listed on the website or not?
They have been in the past. Right now, my web guy, my web designer is updating my website. And
Okay.
so yeah, no, I don't have a calendar on there right now, but he's going to be putting that on there for me.
Okay. So
I'm
check back
changing, I'm
maybe in
kind
a
of
week or two.
changing my brand because I'm really wanting to just speak. I'm kind of at the downhill slope of my career.
Okay.
And so I'm wanting to really concentrate on mental health now and not really speak as much on oral path. I love oral path, but my passion right now really revolves around mental health.
On to the next chapter. So,
Yeah, yeah.
well, thank you so much for speaking to us tonight. It was really great and a lot
You're
of,
welcome. Thank you for having me. I appreciate it very much.
and here's where you can get in touch with us. Head to our website or you can email me directly if you like, membership@healthcarehygienist.org.